What happens with this non-adherence? What happens to the patient, and what's the cost to society?
And actually, let me mention something. I think a period where individuals are at high risk is when they're released from being incarcerated and they don't have a follow-up. For that matter, when they're incarcerated, they receive treatment. When they're released, they may or may not. Okay. So many times we see in the psychiatric emergency rooms, many individuals who were just released, they were taking the medication while they're incarcerated, they're released, they no longer take the medication, and that's when they become ill.
Or the medications change because they less expensive medications.
They just don't see a provider.
Right. Correct.
They're
That's
released.
most of the time.
And they don't continue on the treatment, even if they are released with treatment, they don't continue in that treatment, and there's very poor planning on release.
There's no planning.
You're telling me that there's kind of this abrupt transition
Yes.
without any planning for reintegration.
But even before that, the same laws that apply out in the community apply in the correctional setting. So if the person is refusing medication, the jail cannot force that person to take medication unless they are in such a bad state where they're harming someone, and you can have an emergency treatment, but it doesn't last then without a court order. And you often still have to find that they're meeting criteria of imminent dangerousness to self or others to give them medication in the jail. So it is complicated, and that's why the laws also need to be reviewed.
Do we have a dollar and cents estimate on all of this? And I'm going to use this word adherence again very broadly. The lack of adherence, both by the patient and by the correctional facility, the lack of adherence once released. What's the cost to society of all of this? I mean, we've identified folks, right, who could benefit from treatment, but society is going to bear the cost if they don't get it. Well, what is the cost?
It's a cost to everybody. You start with the patient. We're allowing people to live in their own hell, where they're at risk for rearrest, where they're at risk to get more ill, where they're at risk to have permanent brain damage because their psychosis is going untreated for long periods of time. And then there's the cost to society, the correctional cost, the hospital cost. The doctor mentioned that this population that we don't talk about nearly enough has primary health costs that are even more expensive than their psychiatric costs. And then there's the crime and the petty crime issues and the homelessness issues that come along with it, and the substance use issues that then come along with it that often leads to the criminality because people need to pay for the drugs. And so the whole system is really broken, but it's fixable, and that's the difference here.
But non-adherence of treatment, it is unique to the mentally ill. Most individuals with medical conditions, I'm not saying all, most will take medication, but in mental illness, it is not unusual for patients to refuse their medication, and it's not that they're not aware that they're ill. There's a term called anosognosia, which means that you have the symptoms, but you're not aware that there are symptoms. So that's why the patient doesn't take medication. And in addition to that, many times medications, they don't help and they give side effects.
Okay, but
big problem.
Here, what struck me by what you said is, look, there are a lot of people who are hypertensive and not getting the right drugs, but they don't know they're hypertensive and there are no symptoms. The difference here is the symptoms themselves often mask to the victim, if you will, or to the patient, the need for therapy. Isn't that right? Because you're ill, and in this particular kind of illness, you may not know you need help. Is that fair?
Well, but you might not know that you're ill, but you're not functioning. So
do you know you're not functioning?
Well,
you may not.
Schizophrenia is, I think, a significant different than the other disorders, such as when you're depressed, you know you're depressed, and when you're anxious. But when you have schizophrenia, part of the illness is to not understand that the people are not actually following you. And while I might tell someone, wonderful things about their medication, but if they think I'm trying to poison them, or they think that they don't have an illness, they're certainly not interested in getting the treatment. And we have to go beyond that. And now we do have ways that we can actually have court orders for outpatient treatment. We don't have to put someone in the hospital to have court orders. So we have evolved in some ways.
But there are side effects to these medications, and it makes people feel different, and then they don't want to take it. And the old history of some of these medications was pretty cruel, and so that is part of the problem on trying to get people to take and adhere to their medication. And you really need a great doctor to be able to diagnose them properly, give them the right medication, the right amount of that medication, and help them recover. And it's not as easy as we all make it sound.
Insight is important, right? How many times have you heard, I've heard, and I'm not a psychiatrist, I've heard patients tell me, I was feeling great on my meds, so good I felt I could stop them. Because look, it fixed me. that's a problem.
They stop.
It's very common.
It is common, right? So, if
But
you-
I don't necessarily hear that from individuals that are taking antipsychotic medications.
Okay.
I think there's a different level of side effects for individuals that are taking antipsychotic medications. And I also have to add that when we're dealing with individuals that are minorities, there's a historical context of misdiagnosis. And so we have to have doctors that are willing to take more time, dig in, ask the relevant questions so that we have less incidents of the misdiagnosis.
And be
Let's-
culturally
Can
sensitive to the
Yeah.
Can I put this?
population.
Yes.
I'm just going to take this 800-pound animal, elephant, if you will, put it on the table. I work in an area of disadvantaged people, and I remember I want to take this away from psychiatry for a moment. In the early days of the AIDS epidemic, a lot of these folks believed that they were being poisoned by the meds and that this was deliberate. Is that what you were alluding to? That people don't trust, there's a paranoia, and the disease itself can be inducing paranoia. Is that sort of what you were saying?
No, so historically we know that African Americans have more often been misdiagnosed, and a lot of it is related to how African Americans explain their symptoms. And so we need culturally sensitive clinicians that can better understand how I might describe my illness and my symptoms versus how one of my white counterparts may describe their illness.
Would be nice to be able to listen properly.
Yes, yes.
That's important.
And a part of that is also engaging the family and being empathetic. You know, having an environment of empathetic, supportive nature is more likely to bring out a conversation where you can.
And I think what contributes to that is, like, unlike any other illness, the first responders to somebody's illness or behavior is going to be law enforcement. And they are going to be the least, unless they're trained properly, to be sensitive to the culture, to deal with these issues. And sometimes the first response is, let's lock them up. They're not acting this way because they have a serious mental illness. They're just bad.
It didn't escape my notice, by the way, that you said family. This implies there is one, and that it's engaged, and that it's willing to help. And often that's not the case.
Often it's not, but what we found at Cook County Jail was that when we did engage the family, the patient was more likely to adhere to the treatment plan.
Which also raises the other issue, the HIPAA laws and the CFR laws that go to privacy. In this particular area need some adjustment because it makes it difficult for the family to actually participate in the individual's treatment plan.